Hello, my name is Andrzej Giorgadze. I'm a board certified psychiatrist. I was involved in clinical research on ketamine, and currently I specialize in ketamine therapy, which I have been doing for the past 13 years. We created a small presentation on ketamine therapy that hopefully addresses the most common questions about this therapy and its potential.
Welcome to the deep dive. Today, we're taking a really fascinating journey into ketamine therapy.
It's definitely a hot topic.
Yeah, and we've gathered some pretty comprehensive sources that look into this whole innovative approach for treating, persistent mental health stuff and chronic pain.
Yeah, the research is really expanding.
So think of this as like your quick guide to understanding the essentials. Our mission for this deep dive, to pull out the most vital info about ketamine therapy for you. Stuff like who might benefit, what the treatment actually involves, potential issues, how you prepare. Okay.
Sounds good. Where should we start?
Let's unpack what it is first. It's mainly an anesthetic, right? But now.
Exactly. What's really remarkable is how this medication, primarily used in anesthesia, is now kind of emerging as a major player for conditions that just haven't responded well to the usual treatments.
Right.
And a key thing, and understanding its growing role, is the FDA's approval of the intranasal form, ketamine.
Ah, Spravato.
That's the one, Spravato. Specifically for treatment-resistant depression and also major depressive disorder when someone have acute suicidal thoughts. That was a big step.
So that's the official green light for those specific conditions. But it sounds like from our sources, its potential might go further. This off-label use idea.
Absolutely. Yeah, off-label use just means doctors can prescribe it based on their clinical judgment and, growing research for things other than those specific FDA-approved uses.
Okay.
And there's definitely increasing evidence supporting ketamine for a whole range of other mental health challenges.
Like what specifically?
Well, we're talking about severe depression that hasn't improved with other stuff, various anxiety disorders, PTSD, post-traumatic stress disorder,
PTSD.
depressive phases you see in bipolar disorder, and even obsessive compulsive disorder, OCD. And what's fascinating, especially with something like PTSD, is how ketamine's impact on neuroplasticity, that's the brain's ability to form new connections, might actually help in processing and reframing traumatic memories. It offers a sort of biological basis for hope there.
That's a pretty wide spectrum already, and it's not just limited to mental health, is it? Our sources also mentioned chronic pain.
That's right. The off-label applications definitely extend into several chronic pain syndromes, things that can really, wreck someone's quality of life.
Such as?
Things like neuropathic pain, that burning, tingling nerve pain people describe, complex regional pain syndrome, CRPS, fibromyalgia too.
Okay.
And even trigeminal neuralgia, which is a really severe type of facial pain. The idea here is ketamine might help modulate those pain pathways, maybe reduce how sensitized the nervous system gets.
So it seems like it's tackling both the mind and the body aspects of these tough conditions. But how does an anesthetic do all that? What's the core mechanism?
Yeah, that's the crucial question, isn't it? How does it work beyond just knocking you off for surgery, right? The primary mechanism seems to be its ability to stimulate neuroplasticity in the brain.
Okay, you mentioned that before, neuroplasticity.
Right.
The brain rewiring itself.
Exactly. Think of it as the brain's amazing capacity to change, to adapt, especially after stress or with new experiences. Ketamine appears to kind of grease the wheels for that process, allowing the brain to forge new pathways, maybe break free from those stuck, unhelpful patterns we see in depression or chronic pain. This ability to rewire offers real, biological hope that even long-term conditions can shift.
Okay, that gives us a good foundation on how it might work.
Yeah.
So if someone's thinking about this, what's the actual treatment journey like? Are there different ways it's given?
Yeah, definitely different ways. The method really depends on, a few things. The condition being treated, the person's specific needs, and the clinic itself.
Makes sense.
Intravenous or 5e infusion is probably the common route you'll see, especially for both mental health conditions and chronic pain.
Okay, IV. And what's that like? What can someone expect?
So with IV, a low dose of ketamine is dripped directly into your bloodstream, usually over about 40 to 60 minutes.
40 to 60 minutes.
Yeah. For mental health, a typical starting point might be treatments twice a week for, say, several weeks. For chronic pain, though, the infusions might need to be longer, maybe more frequent.
Okay.
A big plus for IV is the precise dose control. Clinicians can really fine-tune it, adjust the intensity to get the best outcome.
We also saw stuff about intramuscular injections. How are those different?
Right, IM injections. That's a single shot into a large muscle, like the arm or thigh.
Okay.
The effects tend to come on faster, usually within minutes, and often it's also done as a series, kind of like the IV approach.
And then there's the nasal spray, Spravato.
Correct. Intranasal ketamine. Again, that's the one specifically FDA approved for those types of depression we mentioned earlier.
Treatment-resistant and major depression with suicidal thoughts.
Exactly. And it's a nasal spray you administer yourself, and this is important, it has to be done under supervision in a certified clinic.
Right, you can't just take it home.
No. The typical starting schedule is often twice a week for the first month, and then the frequency usually tapers down.
I think I also saw a mention of oral options. Lozenges or tablets, is that common?
Oral ketamine, yeah. Lozenges or sometimes specially made tablets. It's less common, mainly because it has lower bioavailability.
Meaning less of it gets absorbed.
Right, less of the actual medication enters the bloodstream compared to IV or IM.
Right.
So when it is used, it's often more for maintenance therapy,
Yeah.
kind of helping sustain the benefits someone got from, say, IV treatments.
Okay. It really sounds like getting the dose right is super important, no matter which way it's given.
Absolutely critical.
Right.
Dosing is always highly personalized. It takes into account your weight, obviously,
Right.
but also how you respond to the treatment itself. The doctor adjusts it meticulously based on weight, your history with other psychotropic medications, and anything else you're currently taking. Because certain meds, especially psychotropics, can affect how sensitive you are to ketamine.
That makes perfect sense. Our source material also pointed out that Spravato, the nasal spray, has a maximum dose.
Yes, that's a really significant point to understand. Spravato has a maximum allowed dose per session, which is 86 milligrams.
Okay.
Now, interestingly, that 86 milligram is generally thought to be about equivalent to a lower IV ketamine dose, somewhere maybe in the 40 to 50 milligram range.
So it might not be enough for everyone.
Potentially. For some people who might respond better or need higher IV doses, maybe up in the 50 to 100 milligram IV range, that maximum Spravato dose just might not cut it, therapeutically speaking.
Gotcha. And how quickly do people usually feel better? Is it like a switch flips or more gradual?
It really seems to vary. For some, improvement might feel quite sudden, maybe after a specific session. For others, it's more of a gradual unfolding of benefits over the course of the treatments.
Okay.
The source has also made an interesting point about older patients, say over 70. They might potentially need more treatments compared to younger folks.
Why is that?
The thinking is that activating those neuroplasticity mechanisms, that brain rewiring, might just happen a bit more slowly in older adults.
Okay, right. So let's say someone decides this is right for them. They're going for it. What can they actually expect during a session? What's the vibe, the experience?
Well, the treatment setting itself is usually designed to be really calm, comfortable. Creating a safe, relaxed space is key.
Makes sense.
During the session, probably the most talked about experience is what's called a dissociative state.
Dissociative, feeling disconnected.
Yeah, a feeling of being somewhat detached from your physical body, maybe your immediate surroundings. But interestingly, many patients actually describe this as calming or even mystical sometimes.
Really? Calming.
Yeah, it can apparently offer a new perspective on their thoughts, their emotions. It sounds counterintuitive for an anesthetic drug, right? But the research suggests this unique interaction ketamine has with brain receptors leads to these altered states that can actually be therapeutically useful.
Wow. That's quite profound. Are there other sensory things that might happen?
Oh yeah, altered perceptions are pretty common. Sights and sounds might seem different, like music can become incredibly vivid, really emotionally resonant. Some people also describe feeling like they're in a very vivid dream, but they're still conscious, a dreamlike state.
It sounds like it could feel pretty intense, potentially. Is someone there with you?
Absolutely, always. A qualified healthcare provider is present the entire time, monitoring vital signs, ensuring safety, but also just providing support and reassurance if needed.
That's good to know.
Yeah, and the sources really emphasize approaching it with trust, with an open mind. It helps to have a mindset of curiosity, maybe, to just observe thoughts or feelings that come up without judging them, kind of letting them float by.
Okay. So while it can be profound, it's not always just like blissful. What about side effects, things people should be ready for?
Right, important to cover that. Like any medical treatment, ketamine therapy does have potential side effects. The good news is they're generally temporary. usually wearing off pretty quickly after the session ends.
What are the common ones?
Common ones include things like nausea, maybe even vomiting sometimes, dizziness, feeling a bit lightheaded. You might see a temporary increase in blood pressure and heart rate.
Okay.
Blurred vision can happen too,
Yeah.
and those feelings of detachment, the dissociation we talked about.
Yeah.
So, yeah, listeners should be aware these temporary discomforts can happen, even if they're usually manageable.
And are there ways to manage them? Like the nausea?
Yes, definitely. Often they can be managed pretty well with other meds. Anti-nausea drugs like Zofran are common, and something like Dramamine can help if there's a feeling of motion sickness.
Okay. What about more serious side effects? Is that a big worry?
More serious side effects are considered rare, but they can include more significant changes in heart rate or blood pressure. And very rarely, an allergic reaction is possible. This really just highlights why that thorough medical evaluation beforehand is so crucial. It's all about identifying potential risks and minimizing them.
Right.
During that initial consultation, the provider does a deep dive, screening for any medical issues like heart conditions or psychiatric history like past psychotic episodes that might make ketamine riskier.
And the consent forms would cover this too.
Exactly. The informed consent documents patients review go into much more detail on all the potential side effects and risks involved.
Okay, so that thorough prep seems absolutely key, both for safety and for getting the most benefit. What should someone expect in terms of getting ready for their first treatment?
Yeah, proper preparation is definitely crucial. And don't worry, detailed instructions are always given during that initial consultation.
But generally.
Generally, expect a comprehensive medical history review and a thorough psychiatric evaluation. That's standard to make sure it's a suitable option.
And you mentioned exclusions.
Right. Certain conditions, like maybe an unstable heart condition or a history of psychosis, could mean ketamine isn't the right fit. That's all covered in the consultation.
What about practical things like eating beforehand?
Yes, fasting. Usually you'll be asked to avoid solid food for a few hours before your appointment,
Okay.
and typically avoid liquids for about, say, 30 minutes right before the session. Also, your doctor will carefully review all your current medications, prescriptions, over-the-counter, everything to check for any potential interactions.
Right, interactions and getting there and back.
Good point. Transportation is important. You absolutely cannot drive yourself home afterwards.
Definitely not.
No. So you need to arrange for someone to drive you. Using a rideshare like Uber is generally okay, but you need a plan.
I also saw a suggestion about setting intentions. Is that common?
It is, yeah. Many people find it really helpful to set a positive intention or maybe a focus for their session beforehand.
Kind of like a goal?
Sort of, yeah. And often, the clinical team will discuss specific techniques you might use during the treatment itself, ways to navigate the experience.
Okay. And then what about afterwards, once the session's done? What's the recommended aftercare?
Post-treatment, the big things are rest and reflection, giving yourself some calm time to just process the experience.
Makes sense.
Staying well hydrated is also good. Drink
Yeah.
plenty of fluids. And it's generally advised to avoid making any big, important decisions on the day of treatment. Your perception might still be a little altered,
Good advice.
And finally, this is really vital. That period, right after treatment, when neuroplasticity is thought to be increased, that can be a prime time for psychotherapy.
Integrating the experience.
Exactly. Engaging in therapy then can really help you integrate any insights you gain during the ketamine session and help foster more lasting, positive changes.
So, wrapping this up, it really does sound like ketamine therapy is, well, a significant and promising step forward for treating some really tough, persistent conditions.
Absolutely. I think by understanding these key pieces, who it might help, what the process involves, what to expect, how to prepare you, the listener, can feel more informed, more empowered to make thoughtful decisions about whether this kind of innovative treatment could be right for your own healing journey.
This has been incredibly illuminating, really highlighting the complexity, but also the immense potential here. And it definitely leaves you thinking, if the brain has this remarkable ability to rewire itself, this neuroplasticity, what other possibilities might open up when we start approaching healing, not just from, say, a talk therapy perspective or a medication perspective alone, but also by considering the actual architecture of our brains. It's definitely something profound to mull over. Thanks for taking this deep dive with us today.